Hello, hi everyone. It is Saturday, 30th of November, and last day of November as well. And today is day 5 post-op of my total knee replacement surgery. And I had a really bad night. Really bad night. Didn't sleep at all. So as I mentioned, and I've not told that story yet, it will come. There was a real mess up in the hospital that I had the operation, and they got my allergies wrong. They couldn't decide between what was a sulfite and what was a sulfate, or what sulfates were and what sulfites were. And because of that, they didn't give me appropriate pain medication, and then they they discharged me with very mild opiates that aren't touching the pain at all. So now the some of the numbness is wearing off, because obviously they put a lot of local anaesthetic around the joint, and that can last a few days, up to a week actually, believe it or not. Depends how kind your surgeon is. And also you have numbness from the trauma. You know, you've got nerves and muscles and tendons and ligaments and skin and blood vessels that are all being cut. So your body does start to look after itself, and it makes certain areas numb. So yesterday I was showing that I was doing my exercises, and I was saying it doesn't hurt. It was just uncomfortable because of the swelling and the fact that it was, you know, the skin was all tight where the muscle was, where the incision was. However, as the day got on, some of this pain relief, I think, started to go. And I was in really seriously horrendous pain. And you're only allowed so many codeine, paracetamol, considering that's all I've got given after major surgery. So it wasn't a good night. It's not been a good morning. I think getting up and just, you know, trying to keep motivated and positive, and walking, having a shower, getting changed. I have done a couple of exercises, but to be honest, today I'm not going to, because it is only day 5. I'm well ahead of the game. I'm walking without crutches. I'm getting 90-degree bend on the knee. And I'm able to put my leg straight and hang it with support. So today I'm going to have a rest day. I think that's sensible, because you can overdo it, and if you overdo it, you put yourself back. And I don't intend to do that. They say at day 9 you also have a bit of a dip and pain and such like. So I'm hoping a nice chilled day today. I can't really do anything else. I was thinking go up on the moors, have a nice walk with the dog, go round a couple of Christmas fairs, do some Christmas shopping. No. I think that's the hardest thing. You don't realise until you're imprisoned in your own home, the difficulty that you have, and also you have one carer. If you're lucky, you might have more. And it's about being pleasant with your carer as well, regardless of, you know, how you're feeling, because at the end of the day, they're not getting much thanks for what they're doing, because you can't cook, you can't clean, you can't walk the dog, you can't do your washing. You know, initially you can't get in and out of bed, or you can't get in and out of bed easily. You can't change your bedding. You know, there's a lot of things that are basics that, you know, you're upstairs, everything's downstairs, or you come downstairs, everything's upstairs. And sometimes just walking can kick the pain off. I think if I'd had proper pain relief, it may not be so bad. And that's why I'm sharing this, because if you're due to have this, make sure that you know what the protocol is before you choose what your hospital of choice is, and that they make it clear how much pain relief they're going to give you and what that pain relief is. I've spoken to a few people now, and they're all getting the same quality and pain relief protocol that's completely different to what I've been given. Anyway, so here we go. I will show you the offending object. There it is. Look, I've put trousers on today, very loose trousers. So this bit here, I was mentioning yesterday, was very, very painful, and it has been. And you can see that, you know, there's a real specific bruise here, and also this bit here is really, really sore, and over the kneecap. So I was just assuming that was kind of normal. But then I asked to look at my discharge notes, and in the discharge notes, it does happen to mention what they've done and exactly what happened in theatre. Not all surgeons will use a tourniquet. I had the tourniquet, so that's why all my muscles were very, 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 very sore. They're a little bit better today, so that's a good thing. But it turns out I thought I had these anyway. They call them osteophytes, which are bone spurs, basically. It's where your bone starts growing extra bones. And I'd got one that was sticking out on the side of my inner knee, and one that I could feel on the outside of the knee. It turns out that I had two quite significant ones there, and they've been cut away. And also my patella was full of them, so they had to shave all my patella, and then they had to put like a rubber plastic padding on the patella and put that back. So I would suspect that the real horrible pain that I've got is that my tibia and fibia that have the metal on, although they would have been smoothed off because I had these bony growths on them and they've had to be sawn off. That's what that pain is. I can only guess because nobody's told me. Nobody came and told me what they'd done. I've just had to decipher my medical records myself. But that stops the anxiety because I was getting really worried about what is this pain? I don't like it. So that's positive. So day 5, a really bad night, not a very clever morning. I've thrown a load of codeine down my throat and paracetamol, which I don't like doing, but it's either that or I'm just generally not nice to people. And I'm downstairs and I'm going to watch some telly, maybe do some jigsaw, read a book, do some Sudoku. I want to do some yoga, I want to go swimming, I want to go walking. So I'm just going to have to be a good girl. Again, hope you find this interesting. It's not all positive. I know the last two of my posts came across really, really positive and motivated, and that's how I felt at the time. Today, not quite so, and feeling a bit teary and a bit depressed. So hopefully tomorrow will be better. Have a good Saturday, guys. Take care.